Providing care for a child who is ill requires consideration of the needs and behavior of the ill child and the ability of the staff to meet those needs without compromising the care of other children. Many mildly infectious diseases don't cause great discomfort to the ill child, and these mild infections are actually more contagious just before symptoms appear than after symptoms are noticeable. The child's needs can be accommodated in the group without extra risk to the others. Caregivers can adapt the activities for a mildly ill child, provide a little extra attention, and inform the child's parents of the symptoms. But a child who is too ill to participate in most of the program's activities, whose illness demands greater care than the program can provide, or who has a condition that requires exclusion, needs to go home or to a setting that can provide the needed care. Programs that provide care for children who would require exclusion must be set up to provide this care. The best place for a child who is ill is at home, but this isn't always possible. Some early childhood programs provide care for ill children by setting aside a get well room or by referring parents to a facility that cares for ill children. The standards describe the requirements for facilities that care for ill children. A get well room is most effective at containing germs when it has its own entrance and exit, its own toilet facilities, a hand-washing sink, and a diaper-changing area in the room, and a means of ventilating room air to the outside. Caregivers who take care of ill children should have experience in this type of care and training in pediatric first aid and infection control procedures. When a separate room is not available for the care of ill children, a separate area of the regular caregiving rooms can be used. Make sure someone can keep an eye on the sick child. When mildly ill and well children receive care together, the caregiver must be able to meet the needs of all of the children. It may be necessary to add staff support so child-staff ratios do not drop below the recommended levels due to the attention given an ill child. Programs can work together to form a pool of qualified caregivers who can be called on when extra staff or substitutes are needed. Be very careful anytime you need to give medication to a young child. Early childhood programs should have a written policy about the use of medication. Only caregivers with specific training in interpreting dosage and label information and in keeping medication records should give a child medication. The medication should either be prescribed by the child's health care provider or, if it's an over-the-counter medication, it should be properly labeled and recommended for the child by a health provider. A health provider can give a caregiver instructions by phone, but make sure that the instructions are documented carefully.